When a young person is diagnosed with both a substance use disorder and a mental illness or learning disorder at the same time, they are called co-occurring disorders or COD. This condition is quite common. In fact, as of 2018, approximately 9 million people in the United States had a co-occurring disorder, according to the Substance Abuse and Mental Health Services Administration. Co-occurring disorders are complicated, but the more you know about them, the more manageable it will be to support and find appropriate treatment for your child. In this lesson, I'll talk through the nuances of co-occurring disorders, the common risk factors, how they are evaluated, and how to treat and manage them. The overlapping symptoms of a substance use disorder and mental health disorder make the diagnosis and treatment of co-occurring diagnosis a complex process. For example, a teenager who uses cannabis may experience paranoia and hallucinations that could be mistaken for symptoms of schizophrenia. Another example is when depressed mood or anxiety is mistaken for symptoms of the withdrawal process from a substance or substances rather than as symptoms of an underlying primary mood disorder. This is why it's important to be able to identify early signs of both disorders. Signs that may indicate co-occurring disorders include a sudden decline in school attendance or missing class altogether, drastic changes in behavior such as extreme sadness or increased anger, weight loss or other changes in appearance, and isolating from others. Now, let's talk about who is at risk for co-occurring disorders. Risk factors in adolescents and young adults include experiencing abuse and or neglect, the death of a loved one, and witnessing violence such as bullying, interpersonal violence, and even violence within social media or video games. These can all lead to serious mental and physical health problems. Many people struggling with physical pain and or mental illness will often self-medicate with alcohol and other drugs to relieve their symptoms. Adolescents and young adults are no different. Initially, they may experience temporary relief, but over time, substance use often makes their condition worse. As I mentioned in the previous lesson, misuse of alcohol or other drugs in an adolescent or young adult with a developing brain can cause significant changes in brain function. This can trigger or worsen mental disorders. If your child has a co-occurring disorder, they may misuse substances to feel better, but eventually they feel worse. So they use again and in larger amounts to feel better again, and the cycle continues. If you notice any of the signs I've discussed in this video or suspect a problem, you should talk to your child about your concerns and seek professional help as soon as possible. We understand it can be difficult to open the conversation. We encourage you to aim to keep the dialogue open and honest. Remember that young people with co-occurring disorders often minimize their substance use when asked about it. This is why we strongly recommend you seek the help of a licensed clinician or counselor. They will be able to ask you and your child productive questions and then will develop an individualized treatment plan to address your child's specific symptoms. Ask your doctor to recommend evaluation by a psychiatrist, psychologist, or drug counselor. If and when your child begins treatment, their co-occurring conditions need to be treated simultaneously with medication and or behavioral therapy. This is called coordinated care. The types of coordinated care your child may require include medication, individual therapy, structured rehabilitation programs, supported sober living environments, recovery coaches and mentors, and support groups where your child can develop the skills necessary to manage their condition. Because of the complexities involved with co-occurring disorders, seeking comprehensive professional treatment for your child is frequently necessary for their long-term recovery. Thankfully, early detection and science-based treatment for both mental illness and substance use disorder can significantly improve your child's quality of life. As a parent, you can also support your child by creating a healthy and structured environment, participating in individual and family counseling, and educating yourself about the signs of relapse. And remember, you will also greatly benefit from support. More information about how and where parents can find support can be found in the self-compassion and relationship building part of this course. When it comes to substance use disorder and co-occurring disorders, we believe that an educated parent is a more effective parent. With all the information you're learning in this course, one of the most important facts we want you to remember is that you are not alone. We are here to help.